Aisha Virvala. I met Noklile Kumbuli through an Atlantic Fellowship for Health Equity. We had both worked in the journalism and health communication sectors and realized we had a common purpose. Together we started the Health Equity Media Lab and ideated Health. Health is an app and web-based platform that aims to enable access to health information in vernacular languages in a way that's entertaining and relevant. Access to health information in a language one understands well is a determinant of health that influences health behavior and outcomes. Yet the majority of South Africans are excluded from quality health content due to language barriers. There's a ton of health information online, but making sense of it can be overwhelming, especially in areas with low health literacy. Digital health literacy is now a key focus area in public health. Plain language and relatable content not only improves awareness and information, it also empowers users to take charge of their own health and well-being. In a country with low health literacy, our content will be easy to navigate, relevant, and meaningful. A mix of multimedia, explainers, and gamification will allow for an interactive platform that helps users engage with and make sense of the information. The content we provide will also be actionable. For example, connecting users to services like mental health support groups in a rural area, or connecting users to telemedicine services. The content will be all-encompassing and quite holistic, from prevention of disease to mental health and wellness. The app will require users to register a profile and fill out a survey. Based on their profile and selected interests, an algorithm will suggest content. We plan to make use of artificial intelligence to help users make sense of difficult information. For example, explaining blood test results or scanning a food label to determine the nutritious value. We are targeting an underserved LSM 1 to 7 audience. Our audience segment is a mix of urban and rural populations across South Africa. So, for example, you would have a woman who is the head of a household wanting to make the best health choices for her family, or a young man just wanting to stay fit and free of STIs and HIV. Health is centered on credible and accurate information. South Africa has incredible researchers and medical experts who we'll partner with to ensure our content is both medically and culturally appropriate, but that's also attuned to a decolonial and feminist approach. High data costs present another barrier to accessing information, so it's crucial that health is zero-rated or has low data costs. Our envisaged partners are MTN or the Vodacom Foundation. The other partners that we've identified are a range of corporate and civil society organizations who share the same goals of reducing South Africa's health burden, improving health outcomes, and motivating more South Africans to get health. In the competitor space, currently Strove, a South African wellness app targeted at corporate employees, is our closest competitor, while civil society and media organizations all offer snippets of what we plan to do in what is quite a fragmented market. Health operates in a complex political, economic, sociological, technological, and legal environment. Public policy changes provide an interesting context and present a number of opportunities. The most notable of these for us is the National Health Insurance Plan, with its promise of universal health coverage and its focus on health promotion. There's also a growing awareness of health as a public good, and of good health as a basic human right. It's also worth mentioning that according to ICASA, South Africa's smartphone penetration is just over 90%. South Africans spend an estimated 3 hours on social media and approximately 9 hours on the internet a day. Our solution fills a clear market gap. Health is the first platform of its kind in South Africa. It stands at the intersection of health, social justice, media, and technology. And this is reflected in our business model. Let's talk money. We anticipate that we'll need 2.5 million rand to bring health to market. The bulk of our revenue will come from grant funding, then corporate partnerships will account for 20%, and finally, a tiered paid subscription model will make up the remaining 10%. This tiered model is quite important to us because the idea of equitable access is central to our mission. So it's more equitable to charge those who have more disposable income higher subscription rates than those who earn far less. We plan to use the next 4 months to develop a minimum viable product, then roll out the soft launch in October. Based on feedback from our beta users, we'll further refine the product over November and December and hope to officially launch the app in January 2023. What we're looking for is capital investment in funding, as well as strategic partnerships that can help bring our product to market with partners who share our values. So, in summary, information is a determinant of health, yet most South Africans lack access to reliable health information in their home languages. We want to change this. Our solution is to reach these underserved audiences with concise, simple, meaningful, engaging, and actionable information, and hopefully play some part in improving the behavior and outcomes and health outcomes of South Africans. We hope you can join us.